Dr. Toney here, KISS series, diabetes. Here we go. There's two basic types of diabetes. There's what's called type 1 and type 2, also known as juvenile onset or insulin dependent, or adult onset or non-insulin dependent. The one we're going to talk about here is the most common type, and that is the type 2, adult onset, non-insulin dependent, at least initially it will be, eventually it will be insulin dependent, but don't get confused with all those terms. We're not talking about the diabetes that the children get when they're 6 months old or 3 months old or 2 years old. We're talking about the ones that adults get. Diabetes. What is diabetes? Diabetes is a condition when the sugar inside the bloodstream is too high. How does that happen? That happens because of too much intake of carbohydrate. Carbohydrate being simple sugar and complex sugar. Doesn't matter either way. Too much of it in the diet increases the blood glucose. The body can only handle too much sugar, carbohydrate, I'm going to use those words interchangeably. The body can only handle too much sugar for so much time before it begins to break down and starts to fail. Diabetes is a condition where we're excessively urinating, getting rid of the extra sugar. That happens because of insulin resistance. The cells themselves have little openings that allow sugar in through insulin. Insulin acts as a key, essentially. And so it opens up these little openings and allows the sugar to go in. What happens in diabetes is if I continually have too much sugar in my bloodstream, too much sugar is going inside the cell, and the more sugar that goes inside the cell, the more water that follows sugar. Water follows sugar, the cell starts to expand, and then it breaks or explodes. So the neighboring cells around that cell says, hey, we don't like this. We don't want to explode like this guy here. So what are we going to do? We're going to start closing all those little holes up, or all those little windows up. So essentially, when insulin comes, even though it's a key, they're locked. Even with the key, they're bolted. They're dead bolted from the back, so the key doesn't open it. And now less sugar goes into the cell, and the cell's okay. It's not going to explode because it doesn't have too much sugar, therefore too much water going into it. However, where does the sugar go? It stays in the bloodstream, and it keeps rising. We're excessively thirsty. We're excessively hungry. We're urinating. We go to our doctor, draws blood glucose too high, resting glucose, you have diabetes. What reverses this situation? What reverses this situation is stop eating so much sugar. Now people think sugar, cakes, candies, cold drinks, Cokes, whatever. That's not what we're talking about. That, yes, will increase your chances of getting diabetes. Absolutely it will. But the sugars in the form of grains, flours, wheats, oats, breads, pastas, those things will raise blood glucose as well. Even though they're complex carbs, too much in the diet causes the glucose to go up and causes this scenario of diabetes. So how do we change that? We change it by not eating so much carbohydrate. We also change it by exercising. If we stop eating so much, the blood glucose goes down in the bloodstream, and now these cells that had insulin resistance, they start saying, oh, we don't want enough sugar. So they start opening up these windows again, or open up these holes again, allowing sugar to go back in at a normal rate and a normal amount. Therefore, the insulin resistance is reversed. The other thing is exercise. Even if we don't change our diet, although we should, if we don't change our diet, if we exercise, we increase the demand and the need for more sugar, and thereby sugar decreases in the bloodstream, and as a result, insulin resistance reverses, blood glucose drops down, diabetes reverses. So it is from exercise, and it is also from diet, and especially decreasing the carbohydrate intake. And I'm generalizing here, this will meet most people with diabetes. If they do these two things, they won't have the problems that they are experiencing. They won't have diabetes if they do this. Now, there is a point of no return sometimes. Never empty the cross of its power. However, if you're at the point where you start injecting insulin, then what happens is the gland becomes so lazy it starts to atrophy, it starts to fail, it starts to not work anymore at all. And so then you are dependent on insulin. But prior to that point where you're injecting insulin, the body can reverse, and the body can reverse and change and get rid of diabetes. Your body's designed to work well. This doesn't require any kind of drug, any kind of treatment. It requires a modification in lifestyle. Diet and exercise, diet and exercise. Primarily diet, decrease the carbohydrate load. And exercise, do something. Get off your butt and do something. And diabetes won't be a problem. KISS series, Dr. Toney, diabetes. Have a great day.